As you know, axi-cel is a chimeric antigen receptor cell therapy that was approved in Europe to be used in adults with relapsed or refractory LBCL second line. I think this open a new scenario for patients, and it's important to understand the value of the treatment in this setting. Also because in other countries, national HTA agency has already assessed and approved the treatment for this indication. So also in Italy, we developed a cost-effectiveness analysis to try to understand what could be the value for our country to move in an early phase the use of this treatment. Of course, based on the data and on the clinical trial results that we have observed, we have strong evidence to provide an improvement in survival and quality of life of patients moving axi-cel in the second line compared to the actual standard of care. And in fact, thanks to this improvement, we obtain an increasing in quality adjusted life years produced using axi-cel in the second line compared to standard of care. And the improvement in effect is supported also by a reduction in terms of cost of avoiding transplant for patients that otherwise could be used in the patient without axi-cel in the second line. And also what is important is that axi-cel is already available for the third line treatment. So basically we are moving an investment for the system in an early stage in order to improve the efficacy and improve the quality of life of the patient. But if we don't use this treatment in the second line, we have this in the third line. So the cost is offset because we are investing in the second line, but if you don't invest in the second line, we are using the third line. So overall, also the economic impact is quite offset by the avoiding transplant and avoiding the use of CAR T-cell in the third line treatment. And basically the results of our assessment show incremental cost effectiveness ratio of 36,000 euro per quality gain that is below the threshold considered acceptable by the agency in Italy, that is between 40 and 60,000 euro per quality gain. So our results show that axi-cel in the second line for LBCL patient is a good value for money, and is something that could be considered by our policymaker and healthcare decision maker in order to improve the value for this population.